Have you been in a bus and you hear things like that's your belly with a sound big performance man? The purpose always take us somewhere. This video, I'm going to be sharing with you facts about Staphlococcus aureus, demystifying the secrets behind this organism. Coming up, Staphlococcus aureus is one of the most important bacteria that cause disease in humans worldwide. It is the leading of skin and soft tissue infections such as abscesses, boils, cellulitis. Now, although most staph infections are not serious, Staphylococcus aureus can cause serious bloodstream infections, which we call sepsis, bone and joint infections, which we call osteomyelitis. Osteomyelitis, its commonest cause both in children and adults, as Staphylococcus aureus. For those with sickle cell disease, the commonest cause of osteomyelitis is salmonella. Staphylococcus aureus is not sexually transmitted. I repeat, Staphylococcus aureus infection is never sexually transmitted. The facts about this organism. 1. It is important to note that not everyone who is colonized with Staphylococcus aureus ends up getting infection. Those who get an infection, the incubation period, the time period from exposure to the disease to the development of symptoms can be days to years. 2. Many common Staphylococcus skin infections will heal without treatment. However, some may require incision and drainage or antibiotics. 3. Staphylococcus aureus infection is worse in children as compared with adults. The 4th point, a Staph aureus infection can also be gotten via food poisoning or eating contaminated food. Now, the 5th fact about Staphylococcus aureus is Staphylococcus aureus cannot be transmitted sexually from one person to the other. However, contact of breached skin, mucous membranes of the body with contaminated hands or surfaces can transmit Staphylococcus aureus infection. Those who are immunocompromised, patients with HIV infection or AIDS, or those who have had kidney transplants or any transplant surgery, are regarded as immunocompromised. And these patients, including those who have invasive medical devices, these patients are more vulnerable to Staphylococcus aureus infections. And lastly, there are various categories of Staphylococcus aureus infection. Staphylococcus aureus infection, which is usually treated using penicillin agents. There is a second group which are resistant to the first line of treatment, which we call the methicillin resistant Staphylococcus aureus or MRSA. The 3rd group, which still under the MRSA, they are the hospital associated MRSA. These MRSAs are gotten within the hospital environment. Also, we have the community associated MRSA. So these groups, depending on which one is the infecting agent, can make your treatment either longer or shorter. For the resistant ones, they are more associated with longer hospital stays and severe complications if not properly treated. In conclusion, Staphylococcus aureus, a round-shaped gram-positive bacterium regarded as a normal human flora. However, if it finds itself in areas which are not its usual habitat, is the skin, mucous membranes, and some other areas. However, if it finds itself in another environment of the body, like in the urinary tract or in the bloodstream or within the gut, it can cause mild to severe infections. You'll need to go to the hospital and see your doctor to get expert treatment. If you like content like this, do well to subscribe to my channel and turn on your notification so that each time I post a new video like this, you will be one of the first persons to know. See you in my next video, and don't mess things up.